Welcome, everybody. I hope you're having a great ADLM. It's my pleasure to come and kick off this Med Talk session on the value of lab medicine. My name is Alex Carterson. I am the Divisional Vice President of Medical, Clinical, and Scientific Affairs in Core Labs. I have the privilege and honor today of interviewing and discussing with Dr. James Crawford, who I'm going to invite to the stage. He's the Senior Vice President of Laboratory Services at Northwell Health. And today we're going to be talking about what does it mean to become an in-system leader of healthcare? How do you follow that advice? And what are the tenure outcomes of those leaderships? He's done a lot of research and study on this, so I invite Dr. Crawford to the stage. So, Dr. Crawford, you have written about the challenges that Northwell faced about 10 years ago in decisions about outsourcing laboratory services. You know, many systems are still looking at this as an option. However, Northwell's decision was not only to keep its laboratory, but also produce a fully integrated laboratory service line for regional health networks that has had massive success. So, can you just tell me a little bit more about that journey?
Thank you. Two revisions. I'd instructed Alex before he came on board to say I'm now Emeritus.
Emeritus.
I stepped down from the chair and senior vice president position at the end of December. And the other is the 10-year references article that we published in 2019 in Archives, Pathology, Laboratory Medicine. That was pre-COVID. So now it's a 15-year experience. All of my answers are predicated on 10 plus 5. When I arrived at Northwell, it is a reasonable statement that Northwell was a health system of community hospitals with a couple of tertiaries. And there was no department of pathology. I was actually asked to build a department of pathology. The senior vice president person was something that's unusual in the realm of laboratory medicine and pathology, which was I was also, and I argued for this, the corporate person. I was the corporate person responsible for laboratory services. So it was a unified command. And my very strong partner was Robert Stallone, who was vice president for laboratory services. So this really was the two of us. And I put my two fingers together because that is a principle that applies all the way down the line, which is that the professional and managerial leadership, call it administrative, call it what you like, has to be zipped up top to bottom.
Yeah.
It's a partnership. It's not an adversarial relationship. And I would say no matter what your business relationship is between the professional arm of the organization, including independent laboratory, quite honestly, and the health system, however defined, and I'm looking at one of my colleagues, you have to work together. It is a team sport. So that's premise number one. Premise number two is it is a team sport across the entire health system.
Right.
We are all in one team. We are family. And everybody needs to know what the vision is. So you have to build the social construct. And I can assure you, as an outsider coming to Northwell, it took me about 2 years to convince people that I meant what I said. That when I said we work together, that we are a team, that we support each other, that it was real. And that's internal to the sociology,
right,
of what can be called a laboratory service line. But, you know, the fires were already burning when I got there. There were things that had to be taken care of. So I would say the third thing is you have to be decisive. And you must address first the pain points. Right. And I got to assure you, there were two huge pain points. One was anatomic pathology turnaround time, and the other one was the cost of transfusion medicine.
Time, right?
The other one,
turnaround time.
Yeah, it was blood products, and those had to be addressed right away. So if you're looking for value, you must take care of the priorities of the health system, and whether it's a bullseye on your chest or a bullseye on your back.
Yeah.
And I had both, quite honestly. You have to deal with them effectively, which then gets to what I would say is the fourth and most important. is listening to your team, because the people in the trenches know what the problems are.
Right.
And your job as a leader is to empower them and to advocate for them and to promote a workplace where they can do their jobs. And something that has really gotten me through some of the toughest times was also to recognize that we were an employer as well, that we provided a livelihood for what is now 2,600 laboratory professionals and careers. And to keep the workforce always in mind is, again, building the sense of common purpose.
Right.
And trying to be a good employer. And as a leader, you must advocate for both the workplace and the workforce. That's before you actually get to the question, which is, why would the health system want to keep the laboratory?
Yeah, I mean, it's a big question. I think a lot of places...
Which I haven't answered yet.
I know, I'm waiting.
The reason the paper was written was because of the dominoes that continue to fall.
Yeah.
And it is very, very easy for corporate leadership, without even talking with the laboratory, to say there's money on the table. It's a commodity. You get a CBC, you get a CBC, you get a CBC. Same for an HLA, same for other data points. So do it at the cheapest value, and quite honestly, take the one-time payment. It's only one time. There was an offer on the table when I took the job.
Yeah.
So we had to fight it off right from the start. And the argument was, you are going to get better patient care by having a laboratory team internal to your health system. And the word that we use is presence. And a member of the workforce working closely with hospital, nursing, quality, administration, and yes, medical staff, cross-system resilience. And if you go to our 2:30 session this afternoon, you're going to hear some pretty good yarns.
Yeah.
Because stuff happens. Nick Tanzarino is in some of those photographs when stuff was happening. To demonstrate to the health system that every single day you are building their strategies, whether it's starting up trauma, cardiothoracic, liver, transplant, cancer, pediatrics, sickle cell, you name it. Lab is including psychiatry with therapeutic drug monitoring and substance abuse. And lab is essential to building every single clinical program in the health system. And so our operating premise right from the start is, the health system shouldn't dream of anything without including lab. And this afternoon at 2:30, at about the 48-minute point, there's going to be a slide that shows what happens when you don't include laboratory in that planning, because costs can balloon very quickly. You do that every single day, and you never forget that you are at risk.
Well, but I think you brought up a really great point of advocating for the lab. That seems to be where a lot of labs get stuck, is how do you articulate that value when you go up the chain and you start getting procurement and the C-suite and getting, I think you said it really well, how do you get clinicians to buy into the lab and not think of it as a one-off, something that happens someplace other that actively participates in medical decision-making for their patients on the floor, right? So what advice and guidance would you give? Because you have articulately overcome that issue, but what advice would you give to other labs that maybe are struggling in that spot of, I'm seen as a commodity, I'm seen as a value loss, I'm not seen as value added to my health system? What kind of languages should they be using in order to articulate that value?
Well, you're going to hear a lot of granularity in what I say, because every single person in the workforce needs to know how important it is to overachieve in providing our service. In doing so, you're an asset, and that includes the couriers, the people who answer phones, the people who are accessioning, the bench technologists. Every single person of the workforce needs to understand that at every moment we need to provide outstanding service. because that trickles up through the entire health system, whether it's nursing on the floor, whether it's medical staff, whether it's patients who call in. A complaint that comes in from a patient is a fire drill. It is an issue of the first order, and they will come to me. I can assure you they're copied to the CEO of the health system.
Yeah.
And you have to jump on it. So it's a yin and a yang between managing the pain points, and there always can be pain points, and some days are worse than others, I can assure you, and being proactive strategically. So for leaders, there are a bunch of I's: intrusive, insistent, and I'd have to get out my dictionary again to remember them all. But don't be turned away from inserting yourself into anything that's going on. If there's something going on, saying I or my representative needs to be in that room. If you're doing something, lab needs to be part of your conversation. And moreover, you need to be accountable for the action items that come out of it. You need to do that every single day. So the message to the leaders is, don't be reactive to what comes, and make sure you hit your Six Sigma and your around times and give your spreadsheets to your local officers. You have to do that. You must do that.
But that proactive.
But you have to be proactive in inserting yourself into the programmatic initiatives, both to correct suboptimal delivery of health services, but also to create new programs that not only improve the patient experience, improve the provider experience, but also build the brand. Can lab be part of the brand identity of your health system? It can, if you are helping the health system present to the world what a great health system you are. And the missing 5 years, 10 to 15, that was COVID.
Yeah.
All of us had opportunity to bring forward our stories about how we helped recover healthcare, provide for patients in one of the most generational times of need. Keep doing it.
So just getting out there and be aggressive advocates for the value of what you bring as laboratory leaders within the health.
No, it's not the value of what you bring as a laboratory leader. It's the value of what your people bring.
The people.
And it's all of your people. I would add to that, the advocacy includes budget.
Mm-hmm.
It includes workforce, and I'll say some more about that later. You have to advocate for your workforce. And across all of healthcare, there is need in the workforce, whether it's physician, nursing, physical therapy, you name it. There are issues. Your workforce can't do their job successfully without your support ensuring that they're properly staffed and, quite honestly, sufficiently well paid so that they don't choose to go working somewhere else. And so, I lost my mic, there we go. The advocacy that you do on behalf of your workforce means something and empowers people.
So in taking that theme of people, is that a good place to start for labs that really want to initiate this kind of transformation? Is that, to use a colloquialism, the low-hanging fruit of where people start? Or do you need to do something else before you start doing that with your people?
I consider most of what I've said for getting the journey started as table stakes. You should be doing that anyway.
Okay.
It is for the leader to then say, okay, what is the low-hanging fruit? I use the term pain points. What does your health system really want to do? Okay, keep costs down. Well, that's a total cost of care.
Right.
If you're trying to squash the bug, that is the lab budget, you may get a few cents out of that. But if you say, no, as a laboratory leader, I can help you do more to reduce readmissions, to get upstream for patients who are missing their lab tests, because you have that data.
Yeah.
To help your health system meet the quality measures for HEDIS payments and get the proper drawdown from the payers who are the first in line to receive HEDIS payments. You have to understand both the clinical strategies, which is low-hanging fruit, find the programs that need to be built and help build them, but also the low-hanging business fruit, which is what is the money at risk for not providing quality care.
And I think that's the part of the conversation. We always look at what are we saving, but not what are we putting at risk? What could we be saving, and how do we get there?
And so an example, and mind you, this actually gets to be pretty sophisticated stuff.
Yeah.
Because it takes time to learn it. It takes time to be in the meetings, and then it takes time to come back to your team and say, okay, we need to identify the opportunities on the basis of the data that we already have, but map it to the value-based payment system that is now in place. So I'll give you two examples. HEDIS measures for diabetes include an albumin-creatinine ratio, HbA1c, are done on the basis of individual practice site, not at the health system level, which means if you, as a hospital, miss one or two patients that you should have done something, whether it's CLABSI or whatever it is, your star rating drops from 3 to 2, and it's worth 6 and potentially 7 digits because it applies to the whole business. So you actually have to identify in detail where the missed opportunities are on the backside, but the proactive opportunities on the front side. That's on the side of the equation that's HEDIS. Or the side of the equation that's risk adjustment. You have to know the patients who are at risk. And lab informs a huge amount of that, but you need to get the data up front. You need to get the data feed of who is enrolled in the risk-based programs, which right now may only be 5 to 10, maybe 30% of your health system portfolio. By 2030, they're going to be a much greater percent. And you start getting quarters, and then you start getting dollars, and then you start getting $10 bills. You become known as an asset, an intelligence asset, not just a commodity. And I would also say work with your population health, your risk-based leadership of the health system, because their jobs are on the line. And if you can help them deliver on their jobs, I invite these SVPs to our lab meetings, and conflict of interest. I'm chair of the board of directors for Project Santa Fe and Clinical Lab 2.0. I bring our SVPs to those meetings. And coming home from one of them, actually the founding meeting of Project Santa Fe, the SVP said, Jim, I get it now. You cannot be a high-performing integrated delivery network without a high-performing in-network laboratory.
Completely agree. That's where the information's coming from.
That is a message that is largely lost right now. And my feeling is it requires the laboratory leadership to be intrusive and make that point locally. Proactively, and by delivering on every promise you make.
That's a good point. But let me ask you this, because you're now on a 15-year journey. You've talked about some of these pain points, but of those pain points, what really keeps you up at night? And what are some strategies that you did to mitigate those? I know you talked about, the blood bank. I know you talked about turnaround time and other things. But are there other things aside from that really, you feel are crucial pain points that are universals to labs?
I'll go back to my first point. Workforce. What has been the most difficult part of the journey over the last 4 years has been the workforce. My thinking was we have to see this through. The post-recovery, we're not through with COVID, but the heat of the pandemic at least is receding in the distance. We had to rebuild the strength of the workforce, reduce the churn, and to really restabilize our ability to do the routine work. So yes, turnaround time is going right, and we don't have service breakdowns. Because when your workforce is at that high level of stress, and I'm talking 2021 and 2022, that was my greatest source of concern and stress. And yes, it did keep me up at night. The only email I ever sent in 15 years as chair at 2 a.m. in the morning was putting my job on the line in June of 2021 to saying, we have to increase the pay scale in our service line, and I must do what I must do. And I sent it to the top of the organization. And the response I got back, number one, it had to be, otherwise I wouldn't have held my job, was, Jim, do what you need to do. That was an inflection point in being able to recover. But again, looking at people from Northwell who are in the audience, it means we had to bust our tail to justify that change. I talk about overperforming. It has to go down through the entire workforce, the responsibility we carry to deliver on the mission. And it's mitigating those challenges is in detail. It's addressing the service issues on a daily basis. It is using the intelligence from our workforce on what the opportunities are to improve health system strategies in detail, and then delivering.
You had that conversation where you advocated for your employees. How did you then translate that to your employees of developing a high-performing culture?
Well, I'd like to think we already had a high-performing culture. And in June of 2021, that was threatened in a way it had never been before. I would say you do it by walking around. You know, 23 hospitals from the East Forks of Long Island to Westchester County and Staten Island. You got to get on the road and communicate to people in person. And this is leadership. And I asked the same of my division leaders to do the same of our administrative people. Again, I'm looking at one in particular, but to be a person, to the workforce, to listen, to communicate, to hear ideas, quite honestly, to address issues to the best ability, which means, okay, if there's something in Staten Island, I'm going to schedule a meeting with the CMO or the CEO of Staten Island to say, I'm going to use my office to advocate locally. So you don't always succeed. As a matter of fact, one of the things about doing an integrated laboratory service line where the corporate role and the professional role are unified, you as a leader, we as a service line have to exercise our own discipline and what is reasonable. We can't just ask for the moon. We are the ones who have to self-regulate as to what we need so that when we say, yes, this is a priority, people will listen because we're not calling wolves.
Right.
You got to be, if you're going to pull the ripcord, do so very, very selectively. Do it carefully.
Fair enough. So as we close out the session, I kind of have a big question that I'm going to ask you. Particularly here, we're in the Abbott booth, we're at ADLM. How can industry partners such as Abbott work with healthcare systems in realizing this potential, realizing the importance of labs and health systems, and these overarching patient care pathways that you talked about?
To me, this is the most thought-provoking question, because what I've described is something that you can map out. And yes, we published it in 2019, and we're continuing to write in this direction. To me, the industry partnership is the opportunity that has not been leveraged as well as we could. Industry, Abbott and other, are in every single laboratory in the world. So the first thing that industry can do is amplify the message. Northwell may be Northwell. So you're everywhere.
Yeah.
And so whatever message you are bringing to your clients, you have a powerful amplifying effect. So what is the message? For me, it's bringing this concept that lab has to be strategic beyond the laboratory along the themes of what I've been discussing for the last 25 minutes, which means working with your laboratory leaders around the world, but certainly in the United States, to say, this must be done. You are not a commodity. You are an asset. Act like it. Well, what is required to act like an asset? You've heard me speak to the Northwell experience. Project Santa Fe speaks about this on a constant basis, and it is a crusade. It's very easy as a laboratory to just sort of hunker down and say, we got to make sure we get our turnaround tight and keep the time right and keep the cost down. Right. Yes, you must do that, but you have to go beyond. And my message to people in conversation is everybody in the lab doesn't need to be going beyond, but someone does. And hopefully it's leadership. But again, it's something that goes down the ranks. And again, I put my two fingers together, which is the professional leadership, whether it's blood bank, molecular, however far down your table of organization, it's the professional and it's the administrative leadership that need to be unified in conveying the value beyond. And you need to be in all of those rooms, which is why you need to delegate and distribute. It can't just be one person. The third of three is be part of strengthening our workforce. I really do think, and we haven't discussed this, but I have mentioned the fact that our workforce is fragile when understaffed and empowered when properly staffed. And so to me, this is a generational time where we must work together to recruit people into the laboratory profession. It hasn't been a topic formally of this interview, but I think there is a call to action that industry can play a major part in bringing this message to people, adult as well as, middle, high school, baccalaureate. This is a great profession. Be part of it. Change the world. And I'll say one last thing. I'm an anatomic pathologist. I'm not board certified in clinical pathology. My message to my anatomic pathology people is, you touch thousands of people. My message to my laboratory medicine colleagues is, you touch millions of people. And if I'm talking with someone who's considering the laboratory profession, if you want to take care of millions of people, be a laboratorian.
Well, thank you very much. We have time for some questions. Does anybody have any questions, comments? Silent crowd. Okay. Well, Dr. Crawford, thank you very much. Great points. Oh, no, somebody has a question.
Happy to.
Oh, okay.
Oh, thank you. So I was wondering, you mentioned going into the field during COVID, how you balanced visiting people in person in the laboratory versus risk with isolating and how you manage that within your workforce.
So the question is the risk of being in the field during the height of COVID when we didn't know how this was going to turn out. We really didn't. And the importance of being in the field. Northwell was actually the first to publish a systematic volunteer, but it was still, I think, 37,000 employees, healthcare workers of Northwell Health. This is April of 2020, to demonstrate that personal protective equipment works. The seropositivity of healthcare workers, including frontline workers, was consistently below the seropositivity of their local zip code. And that was true for first responders as well. So the Northwell actually, thanks to our bringing the testing online very quickly, and I want to call out Tyler Cheng for leading that, very quickly established that the risk profile was satisfactory. But quite honestly, I think you need to do that anyway. And in those early weeks, certainly the frontline workers didn't know how this was going to turn out and their own personal risk. I can assure you the people running the subways and the police and the first responders didn't. My message to our own workforce is, we are healthcare providers. We don't work remotely. We are here. So you take the risk. It's one of the strange times. If you're in the field, act the part. And it was a conscious decision. And that also was the conscious decision to put in the time. I burned both ends of my lifeline during that period, and I knew that was true. But that's leadership. And I was not alone. The Northwell leadership throughout including laboratory people down the line, did this. It makes all the difference. If you go into a shell, you lose your standing.
So on that note, Dr. Crawford, thank you very, very much. I hope people got inspired by your words. Thank you very much for attending this session of the Med Talk. Have a great ADLM 2024, and hopefully we'll see you soon.